Good morning, ma'am. I am Rica May Castillo from BSN 2109 here to perform home visitation. The purpose of home visitation is to support families in providing an environment that promotes the healthy growth and development of their children. First is the preparation phase. Call or inform the patient to obtain permission to visit, schedule the time for the visit, and verify the address to introduce oneself, identify the agency, and explain the reason for the visit. Good morning, ma'am. I am Rica May Castillo from Batangas State University. I am a student nurse. So, is this Mrs. Mimi Castillo? Alright, ma'am. I am calling to remind you about my home visitation today, September 19, 2023 at 10 o'clock a.m. Are you available at the moment? Okay, ma'am. So, again, I would just like to verify if your address is at Balagtasin First, San Jose, Batangas. Alright, ma'am. Thank you and I will see you later, okay? And then after that is to prepare the bag that contains the standard supplies and equipment needed during home visits. Patients usually do not have the medical supplies they need. So as you can see, I prepared the bag beforehand and I made sure that all necessary equipment are present. So take safety precautions when making a home visit to ensure safety of the healthcare provider. And now we can now do the initiation phase. May I come in, ma'am? You. So greet the patient, introduce yourself, and represent the institution. A friendly approach will help gain confidence and cooperation. Good morning, ma'am. I am Rica May Castillo, student nurse from Batangas State University. So may I know how are you feeling right now?
I'm good.
That's good. So after that is to explain the purpose of the visit to inform the client of what you are going to do. So ma'am, I am here for home visitation and to take your blood pressure. So this is important since there is a high cases of hypertension lately in your community. So your cooperation will be much appreciated, okay?
Okay.
Then after that, we can now do the health history taking. So ma'am, can you please state your name,
I'm Castillo.
your age,
I'm 42.
your marital status?
I'm married.
Are you feeling any illnesses right now?
No.
Do you have a family history of stroke or hypertension?
No.
Do you smoke or drink alcohol?
Also no.
Are you physically active?
Yes.
That's good. Can you describe your typical meal?
Okay. When I wake up in the morning, I drink warm water at night. And my lunch and dinner, I eat pork and rice and also usually eat vegetable.
Okay, that's good, ma'am. So after that is to observe the patient and determine the health needs to formulate an assessment and care plan. So as I observe the patient seems to be in a good condition. And then after that, we can now do the maintenance phase. So first, put the bag in a convenient place and then proceed to perform the bag technique to minimize spread of infection and save time and effort. Then, ma'am, may I ask if there is a basin of water? Okay, thank you. And after that, I'm going to do my hand washing. So, allow me to do a hand washing, ma'am. Going to wipe dry my hands. Then after that, I'm going to wear an apron without apparatus and perform daily. Ma'am, before I start, do you know your normal BP? Okay, that's okay. So your blood pressure, ma'am, is 120/60, which indicates a normal blood pressure. And now let's assume that I already cleaned the equipments that were used. And I'm going to return now the equipments. Also, I'm going to remove my apron. And let's assume that I already sanitized my hands using a alcohol. Then after that is to proceed with health education for hypertension. Okay, ma'am? I will be reminding you some details. So, you can ma'am consult a dietitian to help you with developing a plan for improving your nutrient intake or for weight loss. Okay, and please reduce intake of foods with sodium and fats, and eat more fruits and vegetables, and do regular physical exercises and try other recreational activities, and then limit your vice such as intake of alcohol and smoking. Okay. So after that is to record all important data, observation, and care rendered to evaluate the client's health condition and care plan needed to ensure that the agency will qualify payment for the visit. And let's assume that already record the client's data and make an appointment for a return visit to determine the continuing health needs of the patient. So ma'am, I will see you again in our next home visitation. So are you available on September 25, 2023 at 10 o'clock a.m.? Okay, ma'am, thank you for your cooperation and I will see you next week, okay?